Hi, this is Dr. Randy Franiak of Advanced Pain Management of Central Indiana, and today we're going to be talking about advancing the treatment for back and leg pains. Next slide. So first of all, what is a pain management specialist? Well, we're physicians that are specifically trained in the evaluation, diagnosis, and treatment of all different sorts of pains. We treat both sudden or acute pain, as well as pains that are more long-lasting. Our general goal is to reduce the severity of pain and improve not only your quality of life, but your function as well. Pain physicians receive advanced training in minimally invasive procedures and therapies to help reduce your pain. Next slide. So when talking about spinal stenosis type pains, have you ever felt this way where you say, oh, the sciatica in my legs and feet was so severe, I just couldn't stand to walk, or my pain meds no longer help at all, nothing seems to help me. You go to the grocery store and you notice that you can't really get all the way around the store anymore. When you look at the pictures there, you notice that it's pain when you're upright, pain when you're walking, pain when you're standing, and then the pain from spinal stenosis itself will improve in the seated position. Sometimes it'll go completely away, or if you use that grocery cart and push that around the store. Next slide. There are multiple different sort of options, and certainly we always try simple things first. Physical therapy and various medications can be used to try and help with your pain. Epidural steroid injections are certainly very common and oftentimes can be helpful. And there's more advanced procedures such as spinal cord stimulation, radiofrequency ablation, or even a spinal fusion. Next slide. Well, let me tell you that you're not alone in this. It's suspected that more than 14 million Americans have spinal stenosis and are adversely impacted by it. It's very common as we age, and it's really felt to be more or less a wear and tear type thing, just cumulative injuries over time taking its effect. And we look at spinal surgery in patients that are over 65, it's the #1 surgery. And if left untreated, it can certainly worsen over time, and it significantly and negatively impacts the quality of life. Next slide. Well, what is spinal stenosis? In essence, it's a narrowing. This narrowing typically occurs gradually over time, and so that there's just not enough room where the nerves can get through without being pinched. And when you pinch the nerves that come out in the lower back, this causes that tingling, numbness, weakness, or pain that can go down one or both legs. And again, it's fairly common and expected that relief will be experienced when you bend forward or when you're in the seated position. Next slide. So let's talk about Vertiflex. Vertiflex is one of these minimally invasive procedures that we had referenced earlier. And the Vertiflex procedure it's a simple, minimally invasive procedure that's outpatient, and it can provide some long-lasting relief. In this procedure, a small incision is made and a small spacer is then inserted in between the spinous processes, and it helps relieve the pressure on those pinched nerves. More than 10,000 patients have been treated. Next slide. So how is this procedure actually done? For the Vertiflex procedure, the small incision is made, and then a device is placed in between the spinous processes and advanced. The incision itself and the tube that's used is about the size of a dime. And then once that spacer is actually in position, it will relieve the pressure on the nerves, reduce pain, and then people will notice they can be more active without having to lean forward or sit down. Next slide. So what should one expect after this procedure? Well, first off, let me just say every patient has different needs, and therefore it's important that you follow the specific instructions of your physician. The incision itself is very small, and there's no sutures that are shown on the outside. The stitches dissolve on their own. The dressing is kept over the wound for a couple of days, and then after that, you can take the dressing off and shower. As a matter of practice, we limit strenuous activities for about 6 weeks afterwards, and that includes any sort of excessive lifting, bending, or twisting of the spine, and we limit such activities as swimming, golf, tennis, or running. Light activity such as walking is always encouraged postoperatively. Occasionally, I will actually even use a brace in the immediate postoperative period to help remind you and limit the actual movement of your spine. You may be a little bit sore after the surgery itself. That's normal, but typically within a few days, it goes away. Next slide. So the results are pretty good. You look at this, more than 90% of patients are satisfied with the procedure. Nearly 85% patients are using less medications. More than 80% notice improvement in their physical function, and 75% notice that they have less leg pain. Some really good results. Next slide. There's other advanced interventional techniques that can be used for pain management as well. When we talked about spinal cord stimulation is used for leg pain typically, but as well as back pain. And it has more specific indications. And certainly if you're not a candidate for Vertiflex, this would be something that we could discuss as well. Radiofrequency ablation was mentioned in a prior slide as well. Radiofrequency ablation is really when it's more back and potentially leg pain, when it doesn't really get relieved when you're leaning over or sitting down. This pain itself is more due to the arthritis in the joints, and the radiofrequency procedure is used for that type of pain. Next slide. So some frequently asked questions. If I've had a prior procedure done, am I still a candidate for this? And in each instance, your care, the procedures that you have had done will be examined, your imaging will be reviewed, and then during the consultation, we can come up with the best treatment option for you. The procedure itself is performed on an outpatient basis. You will go home that same day. Insurances typically do cover this procedure. The recovery time is about 6 weeks to get back to most of the activities you want to be able to do. The device is compatible with most imaging and typically will not set off metal detectors. We certainly can't provide you with the medical device card though. One question that's often asked is, does it relieve the pain immediately? And although some people can find immediate relief, it's not uncommon for it to take a week or two or even up to 6 weeks to really get the full benefit from the procedure. Next slide. So at this point, it's time to get up, get back to enjoying your life. Thank you. Next slide. Okay. Please contact the office if you have any questions. Thank you.